when I was starting, um, I was working with my dad, and then we allowed all of them to eat all types of food. So we allowed them to eat rice, bread, processed food, you know. Um, and just with the protocol that I have, I see results, but it's not as dramatic, you know, when I remove some of the medication, some of the food, and then when we started removing the rice, anything that is sweet, we saw results. Like, it was very dramatic. Siguro mga after 1 month, we saw results as fast as 1 month. So that's why for those people who are very skeptic, okay, I only have one thing to tell you: try it first, okay? So now, if you cannot do the entire protocol, it's up to you naman. It's up to you. I have never forced anyone. Our food protocol, it's very simple. Okay? Huwag niyo pa akong awayin. Don't be upset with me. So this protocol I have used for 16 years, and I have so many success with using this food protocol. I have treated a lot of patients with this food protocol, and I can tell you, if you follow it, it's very difficult. If you follow it, it's gonna be beneficial to all of you. So if you really want to try the Dr. Farrah Protocol, again, you have to change your diet. You know, that's the most important thing, because some people, they think that they can just take they can do the Dr. Farrah Protocol without changing your diet. That's actually one of the worst thinking that you can ever think. No rice, no bread, no pasta, no anything white, no processed food. You have to avoid packaged or processed food, okay? Especially tocino, diba? Dahil mga Pilipino, mahilig tayo sa tocino, sausage, okay? I remember when I was young, I would go to turo-turo. Diba? May mga turo-turo tayo dyan, and then we would just eat, you know, the hot dogs there on stick. Actually, cancer on stick. Okay, they're very bad for us. They're rich in nitrates, and nitrates has been implicated in a lot of cancers, particularly stomach cancer. Okay, so do not eat packaged and processed food. They're not good for you. Okay, how about rice? Okay, this is the one that's very controversial, because we are Filipinos, diba? We love rice. Okay, so if someone tells us do not eat rice, you know, we are emotional with it. And I remember there was this politician who told us do not eat rice, and everyone was ganging up on her. Actually, what she is saying is actually simple, because rice, anything that is white bread, white pasta, okay, these are simple carbohydrates. And if you eat simple carbohydrates, they will be converted to sugar immediately, okay? Hindi sila katulad ng complex carbohydrates. So do not believe the hype, okay? If you're gonna tell me like, si Dr. Farrah, she would always ban all of these carbohydrates. That's not true. That's not true. I only ban simple carbohydrates for my patient, okay? And for all of my followers, okay? Back then, when I was in Phil, okay? Ito po ay nung nandun po ako sa Pilipinas. So, because here in the US, I'm not a licensed medical doctor here in the US yet. Okay? So, you are not allowed to eat simple carbohydrates. Okay? But complex carbohydrates, they're good for you. Okay? So, what are complex carbohydrates? Vegetables, yeah, fruits, yan. So, again, fruits, wag matamis. Okay, so sana po nagkakaintindihan tayo dyan. How about milk? Diba? Meron tayong yung milk ng kalabaw, milk ng goat, ano? Especially in Phil, you know, when you're in Phil, everyone loves milk, you know, especially the milk that you get from the Carabao, because they're so tasty, they're fatty, you know. Okay, this is my concern with milk. Okay, wag po kayo magagalit sa akin. This is my concern. Some of the milk in the market, they have a growth hormones. So the growth hormones, these are hormones that you take in. So pag tinake in mo siya, then it can cause growth also of cancer cells. So hindi po siya maganda. Okay? How about yung organic? But this is another problem, okay? When we grow older, as we grow older, at the age of 20 up until 50 years old, we actually lose an enzyme, okay, to process all this milk. It's called lactase. So that time we don't have any more enzyme, okay? So most of us, we are actually lactose intolerant. So if you have lactose intolerant, you're gonna have diarrhea, nausea, vomiting.
You know, when I was studying, they said soya is good, right? Because it has that genistein. You know, it's one of the substances in soya that can regulate your hormones. You know? And then with the advent of the genetically modified organism, everything changed. You know, they're not as safe anymore. So they're just foods that. It's just an imperfect world, you know. That's what I can say, imperfect world.
Okay, nuts. Diba? Ang dami nagtatanong sa akin, Doctor, how about nuts? Yeah. So the problem with nuts is there's this contamination with the fungi. Okay, it's called aflatoxin. So the aflatoxin, and it's especially in peanuts, okay, they can cause liver cancer. One of the most dangerous cancer in the world, liver cancer. You can get it from contamination, eating peanuts or nuts that are contaminated with fungi or aflatoxin. Okay, and some of us, we are allergic. Okay, so if you're allergic to peanuts or nuts or whatever types of nuts, it's better not to eat. Okay, so particularly, how about oatmeals? Ayan, di ba? Ang dami nagtatanong oatmeals, wheat bread. Ayan, di ba? How about them, Doktora? Okay. Now, the problem with them is they are highly inflammatory. Okay? So, usually, yung mga patient or yung mga followers natin, if they eat it, they cause inflammation in the body. Okay? Now, inflammation is one of our worst enemies. Kasi if you have a lot of inflammation in the body, guess what will happen to you? Okay, it's associated with many illnesses, diabetes, hypertension, cancer. How about butter? Diba? If you wanna do cooking, diba? Especially as Filipinos, you know, we love to fry. Diba? We love to fry. All of our food, it's all fried. So what is the best for us? Okay? Frying is not good because it can lead to oxidation. So if you eat oxidized food, if you eat oxidized food, it goes into your system and it can cause heart attack. Okay, so that's why it's very bad for us to eat foods that are fried. But we can eat siguro mga once in a while lang. And if you choose to fry, especially me, I love to fry, you use butter and virgin coconut oil. Okay, because they are saturated fat, so they are very stable sila. So stable on heating. Okay, so pagka hinit mo sila, hindi sila masyadong na-oxidize. Unlike your unsaturated fatty acids, what are these? These are corn oil, diba? So you have your soya oil. So these are all the unsaturated fatty acid. How about olive oil? Diba? Oh, Doktora, magandang olive oil, right? Olive oil is actually good for us. But you cannot cook them. And the problem with them is that if you expose them to air, okay, pag na-expose na siya sa air, it's already oxidized. Panis na, stale. It's stale already. And if you eat foods that are stale, okay, you will have a lot of problems. Red meat. Okay, yan, nakikipag-away na naman. I have so many enemies with red meat. Okay, they do not like red meat. Now, red meat, okay, meat from animals, these are whole proteins, okay, complete proteins. So the plants, they have proteins as well, but they are incomplete. Okay, the animal meat, they are complete. So it's, for me, as long as it's organic, it's grass fed, there's no antibiotics, no vaccines has been given to the animals, you can give it. Okay. You are not allowed to eat simple carbohydrates, okay? But complex carbohydrates, they're good for you, okay? So what are complex carbohydrates? Vegetables, yeah, fruits, yan. So again, fruits, wag matamis. Okay, so when you talk about fishes, okay, there's no farm fish. Okay, so ano ba yung farm fish? Tilapia. Okay, tilapia. Bangus. Majority right now, they are bangus, right? Diba? Bangus. What else? So, marami yan. So, if they are salmon, diba? So, they will tell you, these are good for you. You know, salmon is good for you. Yes, it is good for us. Unfortunately, it's not good for us anymore because of what we did to them, what we feed them. So, it has become one of the worst food that we as a people would eat, farmed fishes. Okay, so they are attributed with cancer as well and with a lot of degenerative diseases. Green leafy vegetables, of course, always green leafy vegetables. Okay, so yung mga malunggay, yan, alugbati, yan. Dapat yan ang kinakain ninyo.
With the food that you are taking in, you know, it's always better to have foods that you grow, that you personally grow. So that includes your produce, your animals, you know, because you know what you're feeding them. Okay? Kasi sometimes if it's commercialized, you do not know, you know, what they're feeding all of this.
No, it's highly processed. You have no idea what's going in there.
Mm-hmm. So it's very important, you know, that you take responsibility. You know, in the end, we're just humans. And for me, you know, I just want to help. So I'm not forcing anyone to believe in what I have been using for a long time.